Hi, my name is Dr. Mel Irvine. I'm here in Fort Myers, Florida, with a very good patient of mine, David. We're going to talk today about some of the treatments that we've been doing for David. We've been doing PRP, or platelet-rich plasma therapy, for him for erectile dysfunction. And David's kind of a special case. And this will go back to some of the protocols that we have here that might be a little different, and what our goal and end point is. So I'm going to let David introduce himself and kind of let you know how he got connected with our clinic, and where he was when he first came to us and where he is now.
Hi, my name is David. I'm a 26-year Army veteran. Was serving in the Army out in California when I had a motorcycle crash that caused me to be paralyzed, and it damaged my spinal cord, so I got a spinal cord injury. As a result of that, I have erectile dysfunction, and that was one of the hardest things, I think, for me being in the hospital. Was being in a wheelchair was not an issue. It was when I found out that I had erectile dysfunction that kind of brought me to tears a little bit, and just thinking, where's my life going to go from here? Since then, I did, while I was in the hospital, did try Viagra and some other pills that really didn't work at all. So the doctors put me on Edex, the injections, which did work, but obviously you can only use a shot every now and then. You can't use it like back to back, and the provider through the VA, they would only give me like 4 shots a month. Yeah. So that means only 4 times that you can actually have sex. And so having another alternative to be able to get an erection on my own, and then even beyond that to get more feeling, and to possibly have an orgasm and ejaculation would be wonderful. And since then, I was kind of a fluke in a way. I was looking to figure out how to use the Edex shots better, and I came across a video that talked about the P shot, and I was like, the P shot? What is this? I've never heard of this. So I thought it was like some new technology, which it is. I mean, so I researched it, called Gulfstream Urology, and I got hooked up with Dr. Mel here, and we've been doing the PRP now. This is the 5th treatment, and I've definitely seen increased size, but that was like a secondary benefit. My true benefit was the fact that introducing stem cells into that area, I've always heard that it would start making other things come back. And so I increased the size. I would get erections randomly throughout the day, which was great. I was able to.
Had that in a long time.
Right, exactly.
So when was your injury?
7 years ago, December 2013.
Okay. And then when you first came, because there is a lot of research out there on stem cell therapy and benefits to that. It's there's a lot of gray areas when you talk about stem cell in the United States, and some of the laws and what it can and cannot be used for, and what people are selling it as. And with platelet-rich plasma, we're actually talking about an autologous source, so it's coming from you as the patient. I'm actually drawing your blood, spinning it down and concentrating it, and injecting those healing and growth factors back into a given area. And the reason it works when we do that is because I'm activating it, so it's almost like tricking the body, right? So it's in your general circulation, but it's just not active until you sustain an injury. Right. So then when I take it, extract it, and then inject it back into an area and activate it first, now I'm, activating that healing cascade to begin to happen. Mm-hmm. So 7 years, and when you came to us, did you have to use the Edex with every encounter?
No, I didn't. I was able to have sex and penetrate without it, and on my own too, I was able to get an erection, and I could masturbate a little bit, but I still haven't had the climax as of yet.
Yeah. And so when you were using the edicts before, before coming here, were you really trying to use the edicts so that you could sustain an erection, or you were just looking into the medication at that time?
Mostly just any time that if I wanted to have sex, then I would use the edex shot. And you know, that's always kind of a like, okay, hang on a second, let me get this shot and get things going.
Yeah.
And then they're like, what? Like,
Yeah.
So
it takes that spontaneity out of it. Okay, so you were using it prior,
yes.
but now you're not really
Right.
having to use it.
Not all the time.
Okay. So, you know, the important thing here is we're with PRP or platelet-rich plasma therapy, we're trying to actually grow healthy penile tissue back. And you sustain injury to that penile tissue throughout the course of your lifetime. And, you know, and being in the military and different injuries that you've had, and then you throw on top of that the traumatic injury that you've had, the spinal cord injury, because all of the nerves that innervate that area, that pelvic area, run closest to the spinal cord. Right. So we started doing these therapies with the goal of, you know, being able to restore the erectile health. And sometimes medications are still necessary, you know, but it's amazing whenever you hear someone say, I don't have to always use the medication. Intermittently, they may still have to. And then someday, hopefully they don't. And some men will still continue to have to use medications because they might have different medical problems that lead to erectile dysfunction, or medical histories, you know, that also contribute to erectile dysfunction. You know, our goal, this is treatment number 5. We're going to do a total of 6, but we're talking about keeping that therapy going for other reasons.
Right.
Because we're starting to see other benefits that we weren't expecting with the therapy.
Right.
And we just want to see how far we can take that, because the penile tissue it's very vascular, and there are studies out there that do show a systemic benefit to men that get injections of different type of, whether it's stem cell or PRP, into the penile tissue, benefits in other places of the body.
Right.
So there's been a few changes since you started coming here.
Yeah, absolutely.
So when you first started coming here, you know, talk about that, because I remember after that first injection when you came back, you talked about how you were getting sensations in the pelvic area that you hadn't had in 7 years.
Yeah, definitely more feeling in that area, and also I think it was the second or third treatment I actually showed you, I moved my leg.
I know, that was cool.
And and now I've actually been able to do a leg press and press weight. It's, you know, it's not like back when I was lifting weights before, but I'm doing about 40 pounds, which is on my own straightening out my legs. And I've been getting a lot more feeling. I'm a T5, which means basically from here down, I don't have feeling, or I'm paralyzed. But I'm starting to get on my back, I can feel like the lower part of my back. Obviously it's pain because it's like the muscles are all tight and everything, but it's kind of interesting to get that feeling and to also be able to give me more stability in my core, so I'm not like falling all over the place. But I've had a lot more like spasms in my legs, so like I can just tell that something is going on. There's changes in my body. I don't know necessarily how you gauge that, but it's definitely, there have been changes since we've been doing the PRP.
Yeah. And, you know, and I was telling David that, you know, I would love to take credit for that, but I'm not going to. It's just, it could be correlating with this. It could be coincidental. But there are studies that show a systemic benefit. So what I would love is to see a researcher kind of pick up that information and try to do something with it.
Absolutely.
And I don't do that research, but I would love to see somebody do it. because it takes a lot of time, a lot of money, and many years to be able to do that type of research. So I would love to see somebody do that. I do want to write a case study on it. And, you know, we've just seen some amazing benefits with David. My intention with this when we started was I knew that what I was doing for men in other areas with erectile dysfunction was making a big difference. And I really wanted to be able to help our veterans, because there are a lot of men who have sustained traumatic injuries or pelvic injuries that have erectile dysfunction. And when you're young, you know, being able to have sex isn't everything in a relationship, but we are sexual beings, and our sexuality and intimacy do matter. And we underestimate how important it is to people. And so my goal was to help some of these men, because you have very young men that are sustaining these injuries, and there's not really any help or option out there for them other than something like penile implants and things of that nature. But there are other things that we can do for them that are not quite as invasive or traumatic to that penile tissue health, so that you can maintain as natural an erection as you can have.
Absolutely.
Right? And I think it's great that David is willing to talk about this, because it's the other thing we don't think about with men. You know, men don't talk about the problems that they have. They talk about the good things that are going on in their life.
Yeah.
You know, and it's not an easy subject to talk about. And I'm thankful. Thank you.
Absolutely. I mean, like I said, it was more traumatic to find out about my erectile dysfunction than it was to be knowing that I'm going to be in a wheelchair for a very long time.
Yeah. Our goal is to get him to the point of being able to climax. Climax and ejaculating are two separate processes. And it's important, you know, that we are able to maintain and restore those mechanisms in both men and women. And when we get there, we'll definitely have an updated video.
Absolutely.
Because we're going to do that.
Yes.
Again, you know, thank you for listening. If you want to hear more about what we have to say, you can go on to our website at sextys.com, sextys.com. It's kind of in the works. I got to get the content on there, and there will be more content to come after that once I start. And then you can also call us or